Niranjan Jhunjhunwala College, I, Dr. Tanya Karipel, cordially invite all of you. We have with us our director, Dr. Usha Mukundan, head of the department, Sucheta Gulwalkar, and all the staff members, and our esteemed guest, Pooja, with us. And here we are on the 4th session of our DBT Star College activity called Online Popular Lecture Series, Gyan Vigyan. And today we have with us a very dear friend, a young, dynamic, and a vibrant personality, that is Pooja Ramchandran. A little about her. She is the VP of Genetic Counseling at Map My Genome and a specialist in personal genomics and preconception, IVF, prenatal, pediatric, and cancer genetics. She's a pioneer in the field of genetic counseling in India. She has been practicing clinical genetic counseling in India since graduating from the prestigious Johns Hopkins University in 2008, where she did her master's in genetic counseling. She also has a master's degree in biochemistry from our very own University of Mumbai and a PG diploma in psychological counseling from IPMS. She has worked as a genetic counselor with a number of other companies like Eastern Biotech and Life Sciences, Induja Healthcare, Positive Biosciences, before joining Map My Genome. She also takes up private counseling. As an expert in medical genetics and psychological counseling, she is often invited as a speaker and educator on clinical genetics and genetic counseling at international and national conferences, as well as workshops and patient advocacy groups. Pooja takes great pride in her association with Cancer Patient Aid Association, which is a non-profit organization where she is involved as a cancer genetic educator and volunteers her time and expertise as a cancer genetic consultant. Pooja is a much sought after expert in this niche profession, and being the first genetic counselor in the country with a formal degree with genetic counseling, she's committed to establishing the genetic counseling profession in India. I'm sure our audience is eager to listen to you, Pooja. But before we move on, I would request the listeners to stay mute and post your queries in the chat window. It would be taken up at the end of the session. So over to you, Pooja.
All right. Thank you so much for the glorious introduction, Tanya. You guys, I am just a human being really who loves science and who loves the humanitarian studies. And to me, genetic counseling just seemed like the perfect merging of them both. So everything that you heard until now was a lie. No, I'm just kidding.
Being too modest and honest.
Oh, thank you so much, Tanya. It was just too much of an introduction. I was waiting for it to get over. I was like, can you please stop talking about me so much? Let's get started with genetic counseling. But thank you for the introduction and thank you for having me. This is so cool to be part of Gyan Vigyan. I'm going to actually ask you guys. I know that Tanya ma'am has asked you to mute yourself. Is it possible, Tanya ma'am, if we can have them like unmute themselves? Because I would love to hear like responses and see their faces and things like that. Is that all right?
Yeah.
All
they
right.
can unmute and speak.
Yeah, they can unmute. Yeah.
Yeah. All right. Everyone just unmute and just let me see your faces. Let this be part of like a normal kind of lecture because it is slightly challenging to be talking to rectangular boxes without seeing your beautiful faces. All right, great. I can see you guys. This is very, very cool. Awesome. What you can hear is my dog, Charlie Brown. So he will be interjecting from time to time. But good morning, everyone. Unmute yourselves. Let's say good morning.
Good morning.
Good morning.
Hey,
good morning, ma'am.
Unmute. This is not going to be one of those Pakao type lectures that I know that very, very college type lectures, not your college. I'm not saying anything about where you are studying at, but let's keep this little bit casual and let's have conversation. I want all of you guys to unmute yourself. I see that all of you are still muted. Perhaps the controller can give permission to everyone to unmute so that they can.
Permission is already given.
All right, you guys, you all have permission to unmute. I need you all to unmute. All right, I'm seeing some of you all unmuting already. Great. Okay. So let's hear this. Good morning.
Good morning.
Good morning.
Good morning.
All right. Bhakti Jadhav, Preeti Oza, Aditi Koyande, Shaheen Khan, Priya Verma, Rahul, Anjana Singh, Rahul, Vinayak Patil, everyone unmute, Merin Anthony, everyone unmute. Come on, come on. And this is only page 1. There is not going to be any roll call. We don't have the time to go through 6 pages of people. All right. We have Preeti K. Oza saying, ma'am, I'm not unable to unmute. Okay,
One sec, I'll just check. Unmute all. Yeah.
Yeah, I have done.
Great. So now,
Good morning, ma'am.
Good morning, ma'am.
Good morning, ma'am.
hi, good morning.
Good morning.
Good morning, ma'am.
All right. Good morning. Good morning. Wow, you guys
Good morning, ma'am.
Good morning, ma'am.
मॉर्निंग मैम
Good morning, ma'am.
अरे वो
गुड
नोट
मॉर्निंग
करते
मैम
कि किसने अटेंड किया है कॉलेज वाले
Pooja, you're going to hear all the sounds around them also.
Jai Shri Ram.
Oh, Jai Shri Ram, good morning, and all other religious ways to say good morning and have a really nice day. All right, so we're here. Let's get started. I need to understand, so how many of you guys, just by raise of hands, just show me, I need to understand, how many of you guys are actually familiar with genetics? Raise your hand. All right. All right. Okay. And how many of you have heard about genetic counseling before? Raise your hand. Oh, just raise a hand on the chat section. Okay. Okay, wow. So a lot of you guys have heard about genetic counseling. This is really, really great. So here is a real life genetic counselor. We are just regular people. And I really wanted to talk to you guys today about genetic counseling. It's a fairly new profession, really. And it's something that most people just have an idea about in terms of from, you know, what you read in your textbook or just in a journal or just from like Googling and things like that. But oftentimes it's difficult to actually find a genetic counselor to talk to them about, well, what does their day really look like? So today, this is what we're going to do. We're going to have quick conversation. It's not going to be very much like a lecture, but we'll talk about, well, what the definition of genetic counseling is, what kind of skill sets might be necessary, what are the kinds of cases I might see during the day, and generally what my whole entire day looks like. Yeah. And once we're done with that, we're going to take questions. So feel free to also, if you have any questions, you know, over here, you can hold on to some of those questions and I'm happy to answer them towards the end. I'm going to assign enough of time so that we can get to all of your questions too. But if there's an urgent kind of a question that you have because it's going to come in the way of your understanding of what I'm going to say next, then definitely feel free to unmute yourself, say, excuse me, ask your question, and then we can all move along. Does that sound good?
Perfect.
Yes, ma'am.
Yeah. So
Yes, ma'am.
Pooja, I would request them to mute because otherwise it's going to interrupt with the your sound.
Okay, so I will let you guys follow instructions that you're receiving from the convener over here. So, okay, everyone is quickly muted. Great. All right. Yes, no, definitely. I understand you're all like at home, so there might be sounds and moms and dads telling you all to do stuff. I understand this. All right. Okay, so let's get straight to it. Well, what is genetic counseling? Genetic counseling, you know, the definition of genetic counseling is by the NSGC, the National Society of Genetic Counselors. What it is basically it's a specialization. It's a healthcare profession, and you have to listen to this really quick, really carefully, because we're going to jump into all the individual components, right, of the definition. I might quiz you also from time to time. I see all of your names. I'm going to randomly call out to one person and ask you guys to repeat what I had said. Yeah, Shrutika is like, all right, bring it on. Okay, sounds good. No, good. This is great. You guys are such a nice and alive kind of an audience. All right, very good. So the definition of genetic counseling over here is it's a healthcare specialty that focuses on the understanding and adaptation. Feel free to write this down. It's a healthcare specialty that focuses on the understanding and adaptation of the medical, familial, and psychological ramifications of genetic contributions to disease. We're probably going to spend all of today's talk really just letting the definition inform the discussion. This is all I have to discuss with you, and it's the most important. If you understand this, you know everything that there is to know about genetic counseling. Okay, so genetic counseling is a process, right? And we'll talk about what a process is in a little bit, but it's a process of helping patients understand and adapt. Let's jump right in. What does it mean to understand something? It's a good question to start about. Oftentimes, when we think about understanding as human beings, and as all of you guys are scientists, already, and we have the intuitive need to cognitively, through our brain, make sense of what is happening, right? We've all heard about, and this is just the scientific mindset, right? So we've heard the story about this man sleeping under a tree, then this apple fell on this man's head, and he basically went on and he figured out, okay, why has this happened? So it's that kind of scientific mindset, right? Who was this man?
Newton.
Awesome.
Newton.
Cool. So just like, when we think about how a naturally occurring phenomenon is something that can sometimes warrant scientific curiosity. Why did that happen? It was definitely not the first time, right, that an apple fell on somebody's head, or an apple fell, or something fell, but not very many people question why. So that's what distinguishes a scientist from a non-scientist, is wanting to understand why. And even though the rest of, the lay populations might not really be a scientist, just as human beings, we are intelligent creatures, even though the recent news does not make us seem like intelligent creatures at all, but we do have intelligence. And as a need from that intelligence, we seek to make sense of the world. And one of the most important ways that we make sense of the world is through cognitive reasoning. It's to use our brains to understand what is going on. That is the definition of cognitive reasoning. And when we think about, well, if genetic counseling is the process of helping people understanding genetic conditions, you have got to imagine can be a little bit complicated, right? Because sometimes these conditions are quite complex. We have to talk about things like autosomes, sex chromosomes, non-disjunction, mutations, and we don't call them mutations anymore in the clinical world because it makes people think of themselves as, X-Men, or it just seems like you're a mutant and not a human being. So respect to individuals is very, very important, because when we're talking to our patients, we're talking to human beings and not to specimens in the lab. And this is a mindset that is very, very important to get out of, to think about, human beings as cases. They're not cases, they're not specimens, no matter how intrigued we might be, by it, and how fascinating a case might be. So it's very, very important to remember these things. So when we talk about understanding, we're talking about not just helping them understand the name of the disease, which, for example, like achondroplasia is a big mouthful, like hereditary hemorrhagic telangiectasia or thalassemia or just craniosynostosis. These are all very big words sometimes, and that itself can throw people off. So we're talking about helping people understand the genetic condition. We're talking about chromosomes. There is some genetic education. We have to talk about things like variants of significance, like pathogenic, likely pathogenic variants, benign, likely benign variants. Then, of course, the very exciting variants of uncertain clinical significance. Are you familiar with these classifications of variants in NGS technology? Yeah, okay, some of you guys are. All right, so when we look at genetics and genetic diagnosis, oftentimes when we're trying to diagnose individuals with a condition, and the main purpose of diagnosing someone is once we have a clinical diagnosis, we know how to take care of this person, right? So for that purpose, genetic testing is often very, very helpful. But as part of the genetic testing process, when we use NGS, next generation sequencing based technology, we can get 5 kinds of results from it. There's 5 different kinds of variants that we can identify from the sequencing process. On one end of the spectrum is pathogenic or likely pathogenic, which means basically that is disease causing and likely disease causing. On the other end of the spectrum, we have benign and likely benign, which is not disease causing or likely not disease causing. Somewhere in the middle of it is a variant of uncertain clinical significance, which is just, I'm just sharing extra biotech genetics information with you guys. It's a variant that we don't know yet what it means clinically, mostly because of one of 2 reasons. Either there is limited information in the literature or there is conflicting information in the literature. Genetics and genomics is an evolving field. Sometimes we know that people who have had a VOUS, a variant of uncertain clinical significance. So folks who were diagnosed with a VOUS, sometimes these VOUSs will get reclassified as either benign or likely benign or disease causing or likely disease causing. And that can completely change, obviously, what it means for the management, of these individuals. And it can also mean something completely different for if I were to be diagnosed with one of those conditions and what that means then for my children, or if I were planning a child. And that's something, that's something that I'm going to have to consider. So when we think about all of these different kinds of variants, we also have to explain to them that we're going back to the definition, right? Genetic counseling is the process of helping people understand. We're still at understand. Yeah. So understanding cognitively is one thing. It's very, very important for people to understand what is going on so that they can finally be empowered. Genetic counseling tends to be slightly different from a regular medical appointment, which is usually, how medical appointments usually go, like you go to the doctor, theek hai, do this, ye kar lo, take this, after 5 days, come see me, and that's the end of it all. And sometimes we don't understand anything that the doctor is saying. And sometimes they use complicated language and things like that. But as a genetic counselor, I wouldn't say stuff like, oh, this individual, I wouldn't say to a patient that, okay, you have an 80% block in your left ascending, aorta, because of which you've experienced a myocardial infarction and you likely need to do a coronary artery bypass graft. And because all of this makes no sense. So this is very medical heavy language, which is English, but it may as well not be English, because finally at the end of it all, people don't understand. So to translate very, very complex genetic information about disease causation, etiology, which is just the clinical word for causation, natural history, which is the progress and the natural progression of an illness, symptoms, treatment options, recurrence risks, other possible complications, agents to avoid, and this could be medication or sometimes exposures and things like that, to have a discussion about all of these in a way that another human being can understand is probably the first part of that definition. Are we doing okay? Is everyone here? All right,
Yes,
great. Okay. So I'm going to keep repeating this, like it's going to become something that you will know by heart by the end of this, the definition. So genetic counseling is the process of understanding, of helping patients understand. So we're done with understand, right? The next one is adapt. Now, what on earth is adapt? We all know adapters, things that we plug into the, so that if the socket is different from our plug, then that is, that can help the plug adapt to the socket. Adaptation is basically acclimatizing to your current scenario. Human beings are actually quite natural at adaptation, right? We talk about how response to stimulus, and adaptation. So when we think about that from an evolutionary standpoint, it's easy to understand, like the examples that I remember, hearing in school is, oh, if somebody pokes you with a pin, then you're going to say, ow. Of course, if someone pokes you with a pin, you're going to say, ow. If someone slaps you on the face, you're going to be hurt. These are very strange kinds of, very obvious kinds of reactions. But imagine this, you have been given information that either you or a loved one or a child or a current pregnancy is likely to have a particular genetic condition, then you're going to have to adapt to that news, right? And so when we talk about adaptation, it is truly a psychological process. You want to help people adapt to, we're talking about the new normal a lot. For a lot of patients who are experiencing a genetic diagnosis, it is a new normal which colors the rest of their lives forever, And so it is very, very important that understanding and adaptation has to go hand in hand, because otherwise you're just being told, okay, this is what it is, you may leave. and then you're not really helping a human being really understand what is going on. And these are clinical responsibilities of a genetic counselor. Like I'm not doing this because I'm a good person or anything. I'm really quite a terrible person. I'm just kidding. But the reason why this is important, Tanya ma'am is saying no. All right. No, but genetic counselors are not doing this because they are great human beings or anything. I think it takes certain qualities, and we'll talk about that later on, to be able to facilitate this kind of medical diagnosis as well as, psychological adaptation. But truly, it is part of who we are as human beings, no? And this is something I talk about very, very often, you guys. Oftentimes in medicine, we use this, what I call the biomedical model. A biomedical model is essentially a model of medicine that focuses on the biology aspect. We all learn bio, right? And we understand how the body works like clockwork. It is really quite magical in some ways. I remember as a kid in college, and even now, till date, it is quite fascinating to me to understand how all of this works. And if we think about just DNA, because human anatomy, so anat is very, very vast in scope. I will not go there at all. It's just beyond the scope of today's conversation. But if we just look at DNA, a few things that fascinate me is how it replicates, for example, how there's, correction almost, for typos, if you will, and not just one type of correction mechanism. There's many types of correction mechanisms, how it clears out all of the crap that can sometimes get generated. There's excision, there's mismatch, there's so many kinds of repairs that go on, in your body. And finally, at the end of it all, it really is something that is worthy of thinking as really, really cool. So when sometimes I think about DNA and genetics, I think it is really, really amazing and fascinating how this whole thing works. But when we also think about, well, we're talking about a human being now, and while it is really, really cool, oh, ambiguous genitalia, because we are so amazed, by neither male nor female, and that sparks all kinds of curiosities in our mind, and that makes us, in a sense, as scientists, I think, excited to see something new. Or ectrodactyly, which is split hand, split foot, for example, or a cleft lip or a cleft palate. These are cases that get presented at scientific conferences and things like that. But when we talk about adaptation, there's finally going to be a human being that is going to have to adapt to all of those things, regardless of how cool it seems or how fascinating it is, or what a great publication is going to be in this journal. I'm going to get authorship. So we have to set aside some of our conflicts of interest to see this person as a person and talk about, well, let's help you adapt with this. And it is not just to be a good person, it is because there is enough of evidence that if someone is able to understand what's going on, then compliance there's higher likelihood of compliance. Compliance is a medical word for following up with medical care. So if I know what's going on, so I have a condition called psoriasis. I don't know, you guys can probably see some of this, right? So it's a autoimmune condition that can affect skin. So if I didn't understand what causes psoriasis, I really think that I might not know what to do to take care of myself. I would probably not know the importance of, say, if I'm prescribed some medicines, why it is important to take care, and why it is important to take my medication regularly, or why should I be avoiding certain things, or why is it important to moisturize, or why is it important to avoid certain kinds of foods. So we know for a fact, and this is true not just for me, I'm just saying this as an example, but we know this from cancer, for heart disease, for diabetes. The more someone is able to understand, then they will follow through. There is compliance with regards to the dietary or the lifestyle modifications or the follow-up with clinical care and things like that. Because sometimes some people are like, nay, I don't believe in medicines. We've heard these kinds of things. No, I don't believe in going to the doctors and all of that. And for certain cases, it becomes really, really important to follow up, especially when we're talking about genetic conditions. A really good example that I talk about is this condition called Marfan Syndrome. People who are familiar with Marfan Syndrome, just can you type in I'm familiar? Or if you're not familiar with Marfan Syndrome, in the chat box, say no. If you're not familiar, say no. Okay. All right, it's much easier. Okay, these are lots of no's. Okay. All right. So fair enough. So let me talk about what Marfan syndrome is. So Marfan syndrome is actually a genetic condition. It is caused because of a disease-causing variant in the fibrillin gene. Fibrillin is responsible for connective tissue development. And when we talk about connective tissue development, so people who have Marfan syndrome can oftentimes be really tall people because their connective tissue tends to be a little bit lax. So bones are also connective tissue. Sometimes their bones grow very, very long. And a lot of times these kids might be basketball players because they reach, really huge height because their genetic condition in a way has allowed them to become really, really, really tall people. So, and other kinds of things that you see in Marfan syndrome are, again, because of connective tissue, you'll see really, really long fingers. Sometimes these individuals can be pianists, and they can, because they have much better reach, on the keyboard and things like that. But unfortunately, because of this connective tissue disorder that is Marfan syndrome, they also have a risk for lens dislocation, which is a dislocation of, an important part of your eye that can shift, and that can cause you to, have diminished vision. Sometimes there is a risk of retinal detachment. So the retina can sometimes detach, again, because just everything is so stretchy, it doesn't really hold place. And finally, it's so elastic, it eventually snaps at the end of it all because our bodies aren't supposed to stretch that much. So retinal detachment can cause blindness. Then we can also see, very, very high arched palate. The palate is the roof of your mouth. Right? The roof of your mouth. So that can be very, very high arch because it has grown a lot within the same space. So then it has to grow higher. And because of that, sometimes we see what we call dental crowding. If the palate is supposed to be like this, then your teeth are here. But if the palate becomes like this, then all of your teeth have crowded around here, right? So we see dental crowding. We also sometimes, the biggest risk, we also actually see things like stretch marks more than usual. It is very normal for all of us to have stretch marks at different parts of our bodies. But people who with Marfan syndrome can have stretch marks on their backs and things like that, again, because of the stretchiness of the skin. They can also have herniated discs, which is the discs between your spinal column, every single vertebra, those can slip out of place quite commonly, and they can be in a lot of pain sometimes. But the biggest risk
for someone with Marfan syndrome is what we call aortic dissection. The aorta is the largest blood vessel, right? That supplies blood from the heart, then it goes out to the rest of the body through this main vessel called the aorta. So the aortic diameter is supposed to be very fixed, but because it's a connective tissue disorder in Marfan syndrome, that aorta, the diameter can sometimes get more and more increased till finally it can rupture. Rupture is called dissection in medical. So aortic rupture is a life-threatening risk for people who have Marfan syndrome. So not everyone with Marfan syndrome will end up having all of these. Not everyone with Marfan syndrome will go through all of these. But we know that when we look at the natural history of Marfan syndrome, these are the symptoms. So if someone comes up, say I'm looking at a kid in a clinic, for example, I'm looking at a 21-year-old or an 18-year-old, for example, who has come in because their doctor noticed that they were extremely tall and they had very, very high power. Myopia is very common, again, because of lens issues with Marfan syndrome. And this is very high myopia. So those of you guys are wearing glasses, don't freak out. You don't have Marfan syndrome, most likely. Don't worry, I have glasses. I also don't have Marfan syndrome. We're looking at huge powers like -10 and things like that. And there are other reasons for severe myopia beyond Marfan syndrome. So don't worry, you're not going to die of aortic dissection. Okay, so getting back to Marfan syndrome, what we really see is that in clinic, I'll talk about, this young boy that I'd seen. He must have been 14 years old, actually. This is all right, so I won't share too many personal details then. Okay, so this was a boy who was 14 years old who was a basketball player. He wasn't a pianist, but he was a basketball player. And we ended up doing a test which came back positive for fibrillin gene variant that gave him a clinical diagnosis really of Marfan syndrome. And when we think about that, obviously, when we talk about the definition of genetic counseling, is the process of helping patients understand. So we talked about, well, all of these things. Marfan syndrome can cause this. We found a mutation or a variant in your DNA. It means that you have this condition. This is what this condition is. And these are the things that you should be screening for, right? So regular ophthalmology evaluation so that we can catch lens dislocation before it moves completely out and we can fix it. We can catch retinal detachment before it is fully detached and we can fix it. We can catch a cardiology appointment so that we can catch, slow dilatation, expansion of the aorta before it disrupts. And we can fix that surgically. And we can catch all of these things once we know what is going on. So those things were put into place. One of the most important recommendations for an individual with Marfan syndrome is to reduce physical activity. Because the more physically active we are, heart rate gets increased, which is really good for the average person who has a healthy heart. But because people with Marfan syndrome are at risk for the dissection, that activity can put people at great risk. He was a basketball player. He wanted to take up professional basketball playing. So obviously, at this point, we couldn't just say, okay, here is your diagnosis, go home and talk to the parents about having, here are your chances of having another child with this condition. But we had to talk about what this means for this kid. And talking to this kid about, well, perhaps you may not be able to be a basketball player because there is a huge risk of death. You have got to imagine that changes the, you know how it feels right now already. You guys are all a little bit, I can see some of your faces, and it's appropriate to think about these things because that's exactly what I would be sitting with a family with, just talking to them about, okay, this is pretty serious now, and to help them understand why. And there are tears sometimes. There is anger sometimes because, of course, it is unfair. No one really asks to have a genetic condition, right? And these are very difficult types of scenarios. So there is anger sometimes, there is sadness sometimes, there is guilt sometimes. Parents feel bad about passing on these genes. It's not that anyone has done anything on purpose, right? These are just things that happen. And all of these feelings are legit, right? We already know that if we're talking about taking good care of yourself, there is no feeling that you have that is or you're not supposed to feel bad, or think positive, everything will be fine, go away. And all these things are quite meaningless. When you're going through something, you want your feelings acknowledged, validated, and you want to be able to cope with what all of that is. So that is the adaptation, element of it. It's the medical adaptation as well as the psychological adaptation. And we talked about finally familial, right? So genetic counseling is a process of helping patients understand and adapt. We're good so far, right? To the medical, we understand this. Familial, we don't know this yet. And psychological implications of genetic contributions to disease, right? So we don't know what familial means. So we understanding, adaptation, medical, psychological, and genetic contributions to disease, we already know, right? We've talked about pathogenic variants, non-pathogenic variants, deletions, duplications, non-disjunction, ring chromosome, trisomies, triploides. It's a little bit non-stop. There's different kinds of genetic variants that can be disease causing. So what is this familial bit? And that is probably the most, not the most important, but these are all very important pillars, the medical, familial, and psychological. These are three main things that we have to address as a genetic counselor. Familial is really, DNA is shared, you guys. We already know this. So when we talk about diagnosing someone with a genetic condition, it has instant implications to their siblings, to their parents, to their children. It's what we call first degree relatives, right? Somebody who's 1 degree away in separation on a pedigree. Have you guys seen a pedigree tree? Like a chart? All right. So my whole day looks like, let me show you. My whole day is basically appointments where I basically just draw pedigree. So here is one. I'm going to take it out really quickly, right? Do you see this? So it's squares and it's circles and things like that, but it's a lot of this pedigree analysis, which is because DNA is shared. And we talk about sometimes inheritance and what it means and who should be the right candidate for testing. And is it autosomal recessive or is it autosomal dominant? Is it sex linked? Is it X-linked or Y-linked? If it's X-linked, is it X-linked dominant? Is it X-linked recessive? Is it mitochondrial? Is there anticipation, which is when we're looking at triple repeat diseases, things like Huntington's or Friedreich's ataxia and things like that, where there's a triplet repeat that can cause people to have this. Anticipation is when the next generation can experience manifestation at a much earlier age. So that is what anticipation is. So there's many kind of genetic phenomena that can impact the family as a whole unit. In terms, again, it can impact the family in terms of medical care, in terms of genetic testing, and obviously in terms of feelings, right? Obviously, this whole thing comes up. And so it is almost like, it's a delicate dancing almost with my patients, to just constantly be checking in with them on giving them one piece of information and then just waiting to see how they might be responding to that. And then if they have more sciencey questions, then to address that. Obviously, in a way that is meaningful. I'm not going to say non-disjunction and words like that. So I'll be explaining those things in simpler language, but essentially conceptually to be the same thing. But also constantly be checking in. Is someone having a bad reaction to this? Because that is very, very important, because these are lifelong conditions, like our DNA does not change. So oftentimes these become very, very important to check in on an ongoing basis. And so that is about it. That sums up the definition of genetic counseling. It's the process of helping people understand and adapt to the medical, familial, and psychological implications of genetic contributions to disease. Is everyone understanding what I do and what genetic counseling is? All right. Awesome. Very, very cool. there's just a few things that are important to remember about genetic counseling before I'm happy to open this up for questions. There's about 15 minutes left. So like I was saying, my day mostly is waking up and doing case prep. Sometimes there's a bunch of medical reports to review before someone can actually get to a genetic counselor. Sometimes they're just going to just an ophthalmologist or just a neurologist. Finally, they will, if no one can understand what's going on, then they get sent to genetics. There's not very many genetic counselors in the country, and medical genetics is a niche profession. So finally, by the time someone gets to me, I'm having to easily look at 50 pages of medical records, just going through everything right since they were born sometimes, you know. So I do case prep, then I do an appointment. And once the appointment is done, a summary letter is sent, usually a different summary letter to the referring physician as compared to the family. The referring physician tends to be very technical language kind of information. And for the family, it tends to be explained out a lot more in language that is easy to understand, that a physician doesn't have the time or the patience to read through this because they have the expertise. So I can use more medical terminology, and usually follow-ups are set up as and when required. But there are 5, I feel like, ethical guidelines in order to work in medicine in general, but also specifically in genetics. So the first one is autonomy, which is respect for people. Really, really important. Whether your patient is a child or whether your patient is a 80-year-old, adult, you have to respect them for what they are, and what their belief systems are, and what their kind of moral worldview is, without imposing my own belief systems on them, because they might make decisions that might be appropriate to them, either in terms of clinical care or pregnancy management, continuation of the pregnancy versus termination of the pregnancy. And really, it is none of my business what I think of it, and I cannot be making moral judgments on my patients, because I have to find a way to respect them for who they are, even if I personally have conflicting opinions, right? So autonomy is the first thing. And the second one is beneficence. Beneficence is, again, it's do good is what beneficence translates to. So the well-being of your patient is always kept right on the top. And then the third one is non-maleficence, which really translates to do no harm. And that harm is physical harm, medical harm, as well as psychological harm when you're speaking about genetic counseling, which doesn't mean that you lie to people and give them false hopes, but there is a way to be honest and also to be empathic and to be sensitive and to be compassionate human being while still having excellent, medical genetics expertise. So autonomy, beneficence, non-maleficence, justice, and equality, just to try to find fairness in the provision of genetic counseling, and in the provision of resources related to genetic counseling and genetic testing and medical care. These things can be very expensive. Genetic testing is really, really very expensive. So I should not be ordering a test if it is not needed, and I have to hold on to some conflict of interest. So if I am I am the vice president of, at genetic counseling at Map My Genome. Map My Genome is a genomics company. So if I were to tell everyone, why don't you do this test? That would be a huge conflict of interest and completely unacceptable as a genetic counselor. So I remember when I came back from the States, I wasn't working with Map My Genome then, and I started to do private practice, basically consulting at every place. And there were all of these genetic testing companies that would come up to, to you wherever your clinic was and be like, madam, please, hamare se test kara lo, we'll give you a cut, basically. And I think it took them less than 8 months. And now, I think everyone hates me a little bit, but nobody comes to me anymore. I don't get any emails. I don't get any phone calls. Nobody comes to meet me. I mean, no one from the industry comes to meet me to kind of get me to sell a particular test. And I think these things are very, very important, because otherwise you're not looking out for the best interest of your patients. So autonomy, beneficence, non-maleficence, justice, and equality. And that's about it. These are just really, really important things. And it's very important to have a scientific mindset to be able to understand stuff in an objective kind of way. And also empathy is probably one of the strongest qualities that really could possibly be a prerequisite, because the genetic stuff, the medical stuff, all that language and all this complicated terminology can be learned. But empathy is just what makes us humans, you know. And I think that we live in a world, sadly, that is making us lesser and lesser human. It can be a little bit tough to be an empathic person, but if you feel like you have empathy, then you recognize what that is, and that makes you a decent human being. But if as a genetic counselor, I think it makes you a really, really effective genetic counselor, because then you're able to sense what's going on with your patients, and you're able to address their needs in a way that makes sense to them. And sometimes we make wrong assumptions also. So sometimes I'd be like, oh my God, that really sounds really tough. And a patient will be like, no, it's not really tough. It's just a big pain to keep going for transfusions, you know, for example, when I'm talking about thalassemia. So sometimes you can check in with people as well, because sometimes we can also imagine that, oh, I must be, if I were in their place, I would feel so bad and this and that. And because we also think of normal as perfectly healthy, and everyone who is unhealthy is abnormal. People with Down syndrome are abnormal. People with blindness are abnormal. That's not really true at all. Nobody is abnormal. If you're a human being, you are a human being, and you have to kind of recognize that sometimes a eugenic perspective has a lot of people seeing people with disability as lower than human, and that is absolutely unacceptable. So to be always mindful of all of those things. That's about it. We have about 10 minutes. What questions do you have for me?
There is a question that's already come in. In fact, there are many.
Sorry, I can't hear you. Oh, I'm seeing there is some question here. Oh,
Pooja, can you hear me?
I see that, Tanya, I still can't hear you very well, but I see a question by Trisha Kapoor, who's asking me, could you please share the best part and the lowest about being a genetic counselor for me personally? And also, could you talk about the state of GC in India and job requirements currently and in the future? All right, great. So let's talk about the second part of your question first, Trisha. Thanks for the question. Let's talk about the state of genetic counseling in India. So, and then job requirements, and then the future. So I'm going to do the whole thing ulta, okay, fully. Job requirements are massive for genetic counselors. There is great scope for employment if you are going to be a genetic counselor, because there's so many biotech companies that are just churning out these genetic tests, and genetic counselors are facilitators of genetic testing. And a lot of times, according to like the ICMR and things like that, the Indian Council of Medical Research, a genetic counselor is needed as part of the prerequisites for a genetic testing company in order to be offered, in order to be able to offer clinical genetic testing to patients and things like that. You have to have a genetic counselor on board. So in India, the job requirements are actually there, and you would likely get very, very nicely employed as a genetic counselor. I'm looking at more questions here. And the future is going to be amazing again of genetic counseling in India and also around the world. Actually, there's not very many genetic counselors, so the future is great for genetic counselors. If you do want to be a genetic counselor, you will have a job, especially now. And yeah, the future is really, really looking nice. Unfortunately, the state of genetic counseling in India is one that is very eugenic. Eugenics is, if you can go back to like Nazi history and things like that, it's the elimination of a population that is not considered genetically viable or worthy. And unfortunately, sometimes, because this is how students are trained by people who don't have a degree in genetic counseling. Usually doctors do this kind of training. They are oftentimes asked to, I mean, I've seen patients who've come up to me and they've said, oh, we're here for an appointment because doctor ne bola isko nikal do. And this is a couple that is talking about their pregnancy, and this is the language that the doctors are using because there is a chance that there is something abnormal. So isko nikal do. And oftentimes that's the kind of mindset. So when people oftentimes will say rubbish, which really makes me very angry, that they talk about how genetic counseling helps the prevention of genetic disease. by prevention, it is basically is not allowing the birth of individuals with genetic disease, and that is not prevention, that is eugenics. So all of you guys, if you choose to be a genetic counselor in the future, remember that if someone tells you this, if someone even tries to explain this to you, and it's not necessarily their fault because this is how they have been trained, but know from someone who's received genetic counseling training that when you think of the world as only perfect if everyone is physically in great shape, then you're thinking about a world that is a little bit bizarre and unrealistic. When we talk about normal, you want to talk about normal distribution. We're talking about Gaussian distribution. Everyone 2 standard deviations away from mean is under normal, which means the vast majority of people are under normal. There are outliers where human beings, we are neither robots nor are we, like whatever. Yeah, sometimes I always laugh when, like a website asks me to prove you are not a robot. I'm like, what is this? But it seems like we do need to prove that we're not robots because we're becoming more and more like that. So normal to me as a genetic counselor is that. And this is something you guys should definitely, I try to drill this into everybody's heads because someday you guys are students now, but you will go on to be genetic counselors and someone will tell you this for sure, that genetic counseling helps the prevention of genetic conditions. Know that that is eugenic, reject it completely because you know what genetic counseling is. What is genetic counseling? It's the process of helping people understand and adapt to the medical, familial, and psychological ramifications of genetic contributions to disease. That is genetic counseling. If a couple wants to have a child with heart disease that the child is going to die in 5 days, so be it. It is this couple's child. Because a lot of times, parents are like, even if I have 2 years with my child, who has trisomy 13, for example, I'm okay with those 2 years because I will see those 2 years as a gift. Great. There will be another parent, another couple that says, it just seems really unfair to bring a child into this world and watch them suffer with tubes and this and that. And then that is also all right for that couple. But we have to recognize that different people can have different beliefs. And this is true not just for genetic counseling and for you students, but in life, I think the world would be a different place if we could just understand that we can all have different belief systems, be it religious or political or whatever, dietary. Like how many people are hating on vegans is beyond my understanding right now, So we tend to reject stuff that doesn't fit in with our worldview. And the biggest thing about being a genetic counselor is to constantly be accepting that this is what this patient is saying to me. This is the truth for them. This is their life. For me, it is an appointment and I give it my all. But at the end of this 1 hour long appointment, I'm going to go on to the next patient. They're going to go on to the rest of their lives. And they need to make decisions that they can sit with for the rest of their lives. And so this stuff is very important. So Trisha, that is the very long-winded, extra passionate answer to your question. In terms of the best part and the worst part of my work as a genetic counselor, the best part is just this. I mean, look at what I do. To me, it's intellectually stimulating, emotionally rewarding, and professionally super fulfilling. I love that I get to do what I do. I'm a big genetics geek, and I'm a humanist. So in terms of political bent, also I'm a humanist. So I don't necessarily care for many things other than just humanitarian work. So for me, this fits. It just fits. And to me, there's nothing else that I would really rather do. And also, you guys don't know this, but I'm also a stand-up comedian. So my genetic counseling work also allows me because self-care is such a big part of your genetic counseling training. If you get trained at a proper place, that just finding balance so that you can continue to stay an effective genetic counselor, because otherwise I would burn out, right? Anyone that is in the caring profession can burn out super, super quick. And Suchita, that's exactly right. Suchita's question is, Pooja, you also need to be mentally and emotionally strong, in order to work with patients. That's absolutely right. So self-awareness is probably the most important thing that there is. yeah, so you do have to be strong, and you mentally, emotionally, psychologically, and not strong as much as aware. I think strength is overrated. It's perfectly fine to be super vulnerable. And like there have been times where I've sat and I've cried with my patients as well. But that doesn't make me a weak human being. It just makes me capable of empathy, and it's okay. I think strength is overrated. I think you just have to be aware and just have to be honest with where you are. Obviously, I can't be crying constantly all the time for everything. So yeah, that's what that is. Sucheta, what would you advise genetic counseling to newlywed rather than Janam Kundli? Of course, I would advise genetic counseling rather than Janam Kundli. Sucheta, that's such a fun question.
Yeah,
What's the
this is what
educational
I
requirements
want the
to
students.
Prityoza's question?
I want the
What is the
students
educational
to know.
requirements to be a genetic counselor? I mean, what after BSc? So what I did was I did my BSc in I think I did a double major kind of thing. Tanya and I actually went to the same college. So so I did like 3 units microbiome, 3 units biochemistry. Then I did the MSc in biochemistry from Mumbai University, and after that I did my course in genetic counseling. But usually it's offered as a master's course. But you want to be just smart about what kind of course you're taking up, And I would say that most of the courses that are being offered in India are taught by people who are not, they don't have a degree in genetic counseling. It's like, if I want to learn how to sing, I want to learn from a trained singer. If I want to learn how to dance, I want to learn from a trained dancer. So if I want to learn genetic counseling, I need to learn from a trained genetic counselor, or you're going to be learning strange things like, oh, genetic counseling is the prevention of diseases and just random stuff like that. So education is very, very important. And perhaps in the next few years, I'm planning on starting up some kind of a genetic counseling training program. And I really don't know when or how I'm going to be able to do that. But yeah, so usually the requirements in terms of training and prereqs is usually a bachelor's degree in some kind of science. It helps if you have some kind of volunteering experience or some kind of experience with regards to just taking care of people beyond just studying. So just crisis intervention, working with children with disability, or working at a helpline, that is crisis intervention, things like that might be really helpful. Pankaj Yadav, you have a question. Guys, if you have more questions, feel free to bring those on, okay? I'm still taking questions. Pankaj Yadav, your question is, in some parts of the world, inbreeding is common practice, which leads to various genetic disease. Genetic counseling should help such individuals. Pankaj Yadav, that's a great question. And that again, to me, when we say things like these, to me, the subtext, the undertone of this is that आप लोग क्या inbreeding कर रहे हो? ये गलत है, आपको नहीं करना चाहिए. That's almost like what we are saying to people when we say, oh, inbreeding is bad, or marrying your, relatives is bad, and things like that. But endogamy is very common within the Indian context. And I'm not just talking about Parsis and inbreeding, because that is again a community that gets a lot of flack for this, but these are traditions. So the cultural context, we cannot remove out of this. So can you imagine if you were a couple, who had married your distant cousin, for example, because it was the world that you grew up in, this was normal, and then you have a child, and then the doctor said, tumko ye shadi nahi karna chahiye tha. You've already built a life, and someone is telling you that, no, this is wrong. You should go to genetic counseling so that that your children are going to have all these problems, and maybe you shouldn't have children. That is really not what we should be doing as genetic counselors. So yes, Pankaj, in many parts of the world and in India as well, endogamy, which is marrying within the community, is very, very common. We don't like to call it inbreeding, because it's much better for us to say, oh, inbreeding in other parts of the world, than to talk about, like, just like how we talked about, oh, Black Lives Matter. But we don't talk about Dalit lives matter, here in India. It's much easier to look outside and say, हाँ, वहाँ पे ये होता है. But I mean, let's look into our own backyards as well. So anyways, within India, endogamy is very, very common. We already know, that people commonly marry within the same community, within the same caste, within the same subcaste. These kinds of things are just true for India. And that is also, in a sense, a very limited gene pool. And I think everyone, regardless of whether there is endogamy or whether there is no endogamy, everyone can benefit from just, genetic counseling preconception, because it doesn't matter who you have married. All of us, are carriers of at least one or two kind of genetic variants of a genetic condition that doesn't affect us, but we could pass on to the next generation because it's a recessive condition. It's very, very common for people to be a carrier of something that they don't know. And this is regardless of all of the other things that are very exciting to us, like inbreeding, or oh my goodness, this and that. Just everyone should probably have preconception genetic counseling, so they can talk about, well, here are your options here are the risks based on family history, medical history. Here are the testing options. If you want to test, great. If you don't want to test, great too, But yeah, genetic counseling is helpful. A degree in psychology, Shreya. Pankaj Yadav, hopefully that answers your question. Let me know if you have any follow-up questions to that. You're very welcome, Trisha and Preeti. Shreya Yadav asks, is a degree in genetic counseling also required to, is a degree in psychology also required to be a genetic counselor? It's not necessary, but you can't be a genetic counselor without some psychology background. So most genetic counseling training programs outside of India will really work through some of the most psychological aspects of it. But a degree in psychology is not required to be a genetic counselor. Yeah. RJ College asks, how are people in India accepting taking genetic counseling? A question from Sucheta. It's a healthcare specialty, right? So genetic counseling is just a healthcare specialty. It's a very niche profession. And for the people who need genetic counseling, I mean, they really appreciate having access to a genetic counselor. So again, that question is a little bit loaded, Sucheta, so how are people accepting or taking genetic counseling means that, oh, genetic counseling is something horrible. And it is horrible if you believe that genetic counseling is prevention, but that is not genetic counseling. Genetic counseling is not telling people, oh, you should not have children. And genetic counseling is not telling people, oh, your pregnancy has Down syndrome, you should definitely terminate. And there are people who practice like this and call themselves genetic counselors. It makes me mad. So from that perspective, obviously, to me, that would be unacceptable. And people in India shouldn't accept that kind of genetic counseling, because that's not genetic counseling, that's eugenics. But when I'm talking about only my own experience, I know that everyone that was able to find me, and people get to me just like searching, like online for a genetic counselor, and they finally get to me, and they're very, very appreciative of having the opportunity to speak to someone that can understand what they've been going through for years and years, and who can actually come up with a good medical plan for them, and who aligns themselves to their world, and tries to understand them, and tries to come up with a solution that makes sense to them, whatever that solution might be. Whether I agree with that solution or not is none of my business. Do I believe that genetic counseling should go hand in hand with gynecologist? So, Cheta, that's again a really good question. I wouldn't say with gynecology as much, but perhaps with obstetrics. And so there's a few branches of genetic counseling. Obstetrics deals with pregnancy, and so I think that's where you're getting the the gynecologist from. So genetic counselors can have expertise in prenatal, where an obstetrician. Sorry,
there's a call there. Let me just, okay. Am I back? Can you guys see me?
We can hear, but we can't see you.
Okay, it'll probably catch up then.
Yeah.
Okay.
Probably.
So
yes,
counseling,
but we can hear you.
All right. So one specialty is definitely that, is prenatal. The other specialty is pediatrics. Sometimes we can see, children that have, there, now you can see me, that have, genetic conditions or just conditions that need diagnosing. And just because something is complex doesn't have to be complicated. So genetic counselors can deconstruct that. So obstetricians, pediatricians, neurologists, cardiologists, ophthalmologists, hematologists, pulmonologists, endocrinologists, so there's different kinds of specialists. So because DNA, right, genetics can affect your whole body in some ways, it is the blueprint of life in some ways. So whenever anything genetic is involved, it's a good time to consult with a genetic counselor. So in addition to an obstetrician, there's all these other branches of medicine too that I can sometimes get referrals from. Just recently, I spoke to a neurologist who's trying to from Dubai or something like that, and they were trying to kind of brainstorm a very, very complicated case, and I think we arrived at the right kind of testing modality, because you also have to get to the right strategy of testing. I can't just, like a joke that I usually do is that if I'm looking for breast cancer, then I can't take a stool sample as my specimen, So it is very, very important to be able to identify the right test and to be able to identify the right kind of sample. And doctors just don't have the genetics expertise for it. So oftentimes those referrals will come from anywhere in the spectrum of medicine. Are there any recognized, Namrata, genetic counseling training programs in India? I mean, there are several that are that exist. They are recognized by the Indian board, but yeah, there are some limitations and to the scope of training that you might receive from these. But it's a good place to get trained as a genetic counselor, as long as you remember, the things that I've talked about. And I feel really, really strongly about this. It's great to have genetic counseling education and great to have genetic counseling training, but we have to, how, with great power comes great responsibility. So there is a responsibility for genetic counseling training programs to not be eugenic in their approach, because that is just hugely unacceptable. So there are some training programs in India, and they offer reasonable, medical genetics types of experiences, and I think you could benefit from getting trained over there. This is something you want to pursue. Hopefully, in the near future, I will have a genetic counseling training program. It has been very, very close to my heart, and let's see where that goes. But regardless of where you choose to train from, always remember that genetic counseling is not prevention, is not preventive medicine like that. Yeah, you know what genetic counseling is. It's the process of helping people understand and adapt the medical, familial, and psychological ramifications of genetic contributions to disease. Okay. Genetic counseling assistant positions available common in India before taking up a master's in GC. Trisha, I take on students all the time. I mentor a lot. I care a lot about education, and I've just had a bunch of students. So you can ask Tanya ma'am for my contact information, and we can be in touch. So then also from Suchita, how are the facilities in India for the child born with genetic disorders? India working in those directions as compared to in Western countries? So India is definitely working in those directions. Like newborn screening has been put into place in many places. It's not as comprehensive, but it's a start, and it's great. To me, it's great. So when I started over here, more than 10 years ago, there was nothing. People also didn't know what genetic counseling was. There was no genetic counselor. Nobody knew anything, and a lot has changed since then. So the facilities in India do exist. In fact, there's a lot of work with thalassemia and all of that going on with the transfusion clinics and all of that. A lot of good work, in Gujarat, they're doing amazing work. In the south of India, they're doing amazing work. So there is some really, really good work that is being done in India. We have some catching up to do for sure, but we're making progress at our own pace, but I think progress nonetheless. So I must say that we're doing much better than we were doing, say, even 10 years ago. Actually, a lot of progress is being made. So facilities in India, we can't compare them to the facilities in more Western countries, but there is slowly that is happening. And that is really, really cool to watch for me as a genetic counselor, and also for a lot of parents and families. I think a lot of these things are driven also by families and things like that, because they really see a gap in the services. So a lot of times these are, parents and families that are empowered to do this and put stuff together and have support groups and things like that. So I speak oftentimes at these support groups because they will want someone to come and talk about what is autism and say what are the causes of autism and things like that. So it's really, really great to be part of such advocacy groups, such as patient support groups and things like that. And so I don't know, Trisha, if that answers your question. So yes, there is some facilities, not the same as what exists in the Western countries, but we're making good progress. Tanya, how do you keep updating yourself in your field of specialty? It's a great question, Tanya. Well, the truth is that if you want to be a genetic counselor, you have signed up for a life of being a student forever, which I think is great, So I also, it's a lot of studying constantly. It's a lot of case prep constantly. And that's just how you update yourself. And mostly, I think you learn a lot from your patients. And I feel like that's just something that, for me, many times there's much more that I learn, and there's much more that I get from a genetic counseling session than I give of myself. And a lot of that has to do with learning, not just about a genetic condition, but also sometimes about the human condition. And I think it really is very, very meaningful aspect of what my work is as a genetic counselor. So updating myself periodically, it's an ongoing thing. There are oftentimes authorities like the ACOG or the ACMG or the ABGC or any organization that is an authority in a particular field will put out these recommendations or guidelines, and those tend to keep changing, like say screening recommendations for colorectal cancer, or like first trimester screening for couples that are pregnant and things like that. So there's constantly those things that keep getting changed. So it becomes your responsibility to either be on top of it on a regular basis, or if you're seeing a patient with a particular condition, make sure that you've done enough of case prep so that it is all updated stuff that is your understanding, because then you're going to be teaching your patients basically about the stuff that you have learned. So it's constantly learning, constantly educating, and I think just constantly just growing together as community. All right then. Perfect. You guys, I like, these are difficult times. This is of your questions, and it's important to relax and to de-stress. And here's a question: how does DNA unwind? You want to know the answer?
Shoot.
That's it. All right. Oh, there's some noises. By helicase, yes. Shah Kulsum, you got this. FYBT. Well done. This is so cool. Awesome. Awesome. All right, this is it. Tanya, like over to you. And unless anyone has any other questions, thank you so much for inviting me, and thank you for listening to me. Stay in touch as and when you need to.
Thanks a lot, Pooja.
It was a great session. And I'd like to invite Smruti, Dr. Smruti Thombre, to give the vote of thanks.
Yeah, hello, Pooja ma'am. So on behalf of Department of Biotech and Ram Niranjan Junjunwala College, I want to thank you, ma'am, for your insightful session. I will not say the presentation since it was not a monologue, it was a dialogue. So I think you have opened a completely new window for our students, and then they will definitely can think of becoming genetic counselors later. But beyond that, I will say, ma'am, whether they become a genetic counselor or not, you have stressed upon three very important values. That is to understand the psychology of the other person, having respect and empathy for others. I think that will go with them forever. That's what I really feel. So I'm really
Oh,
appreciating you that you have spared some time and then you are here to talk to our students. So thank you once again. And I would like to thank Dr. Himanshu Dauda, our principal, Dr. Usha Mukundan, that is our director madam, to give us this platform so that we can call the eminent personalities and students can be of benefit. And special thanks to Tanya ma'am for arranging this session for our students. So students can get in touch with Tanya ma'am so that they can in turn get in touch with you. So again, I'm extending heartfelt thanks to you, ma'am. So thank you
of
very
course.
much. The students are
Yes.
definitely benefited.
You're very welcome. And for those of you guys who want to follow my comedy career, which is like a bit of a joke, like it should be, please follow me on my Instagram. It's at Pooja Path. I try to mix all of these things. You know, I try to talk about science. I try to talk about empathy. I try to talk about being a normal thinking, rational human being through my comedy. I really try to blend all of these things because, again, I feel like there's very many important things to talk about, you know. And thank you so much, Smriti ma'am, for saying the three things that you got from this session. These are very close to my heart, actually. It means so much to me that this is what you pointed out. And this is what I want to do in life, is to talk about these things, whether someone is a genetic counselor or not. Like you were saying, you know, I think these are the things that are important. And we forget this because we get caught up in all of the nonsense, you know, with, I mean, sure, making money is important and like we have needs and all those things. And sure, but there are things that are much more important that we sometimes can forget. It's very, very important to always stay tuned to who we are as human beings so that we can be there for each other. You know, like we talk a lot about the society is getting a little bit more individualistic. A big part of what I do as a genetic counselor is providing empathy and providing care. And I just want to not limit that to my patients. So I do stand-up comedy where I talk about this stuff, whether it is about health, whether it is about the caste system or religion, or just, you know, people getting angry because your opinion differs from my opinion. Okay, let's kill each other because of it. You know, it just, to me, it bothers me, the state of the world that we live in. I wish for a better world, even though people might not always be as hopeful. I have hope, and I have hope that you guys are the future. You are the youth. Remember this conversation forever. Remember, you can shape the world to be a world that is more loving, that is more caring, that is more empathic, and that is definitely more human. So thank you so much. Oh, your Insta. All right.
They're
Thank
asking
you,
about your
guys.
YouTube channel also, ma'am.
Yeah, they want to know whether you have a YouTube channel.
I do
Now
have a
you're going to
YouTube
have a
channel.
lot of followers, Pooja.
Oh no!
Yep.
Okay. Don't be too scandalized with some of the language that I use over there. But the essence of my message is always, it's this. This is who I am as a genetic counselor. This is who I am as a stand-up comedian, because really this is who I am as a person. But I don't want to make this about me. I'm wanting to leave you guys with this, you know. Always remember how this feels today. You know what your heart feels like. This is what empathy feels like. We don't get a lot of it outside in the world, but you know how warm and fuzzy you feel right now. It can be a very moving experience sometimes because we don't get this so often. So remember how this feels, and remember that we're all capable of it, and remember to never become the person that hurt you, because sometimes that is very easy. You know, you bully me, I bully the next person, we pass that on. So we can pass that on also, or we can pass this on. So always make the right choice as far as possible. Again, thank you so much.
Well said.
This
Thank
opportunity
you.
has meant so much to me. Thank you very much.
Thank
You
you,
guys
Pooja.
are awesome.
Thank
Of
Thank you
course.
so much, Pooja. It was really nice to have you.
Oh, awesome. Thank you for inviting me, Tanya. This has been really, really quite cool. Bye.
Bye-bye. Take care.
Bye. Bye.
Bye.
Tata.
Bye, ma'am.
Have a nice
Bye,
day, everybody.
guys.
Bye, ma'am.
Bye, ma'am.
Hi. Okay,
Hi,
hi.
ma'am.
Okay, maybe you know what? Let's do all this. Let's switch on your videos, and if someone can just do a screen grab of everyone, just smiling, I would love that. Or maybe we can just say like, yeah, empathy rocks or something like that. I don't know. All right. I love to see all of your nice smiling faces. This has been so great. Thank you so much for your attention. Thank you so much for being here. And you guys, the future of the country depends on you. You guys have heard all of this before, but you've never heard it in a way that is just always remember to be exactly who you are in this moment. We're all capable of amazing stuff, even if it is something small and something not so huge from another person's perspective. You are amazing exactly the way you are. Don't try to be like anyone else. Be exactly who you are, because otherwise we would just be clones of each other, and that is not a lot of fun, and I know this. I'm a genetics person. We don't like clones are really quite like no fun. They're not individual. They don't have their own personality. So be exactly who you are. Be who you are with pride, and go forth, and whatever it is that you want to do, remember that there is no substitute for hard work. But that doesn't mean that you think that it is impossible just because it is hard. I have to say that when I came here 10 years ago, there was nothing. My first salary was 3,000 rupees. This is after my grand genetic counseling degree from Johns Hopkins, but it has been 10 years since. And I can tell you that if you do work in a way that is honest, and that is true, your work will eventually speak for itself. Yeah, so don't let go of your hopes and of your dreams, and all of these things can come true. Make your own dreams. Don't follow the trend. Don't follow what everyone else is doing. If you don't know what to do at this time in your life, no, that's a great thing. It's very good to not know what to do, because it means that you are like clay. You can keep shifting and you can keep discovering who you are, and there'll be many different elements of who you are that you will discover. It's going to be really, really cool. So don't stress out too much. If you don't know what to do, I think it's a good thing, because then you'll be open to understanding some more. So don't put a lot of pressure. Hey, Gabriel, I see Gabriel over there. All right. Thank you so much once again. And
Thank you.
all right. Okay, we've said bye-bye now to each other 3 times. We're truly Indians, all of us. Our byes never get over at all. So now I'm definitely going to leave. This has been great. You guys are awesome. Have a great rest of the day. Bye.
Good
Bye, ma'am.
afternoon, all, and thank you very much. Bye, Pooja.
Bye bye.
Jai
I'm ending the
Jinendra.
session. I'm ending.
Okay, bye, ma'am.
Okay, ma'am.
Bye.
Bye, ma'am.